local authorities work together with the all the parts of the NHS that serve the community, and all the voluntary sector as well. And this is an opportunity to do that. So I really welcome it. At the end of it, there's a question and answer session. So we will move into a live activity at the end. But can I hand over first of all to Peter Axton, our Chief Executive, who will introduce the various sections of this. Thank you.
Thank you, David, very much appreciated. And I would also like to extend that warm welcome out to a whole host of people on today's session, which is brilliant to see. I know many of you, but interestingly, I don't know some of you, and that's equally great that we are pulling into these conversations people that perhaps we should have done previously but haven't to date. So a warm welcome to everybody. So for me, this is a really exciting moment in the life of combined healthcare. Of course, right now we are under significant pressure when it comes to COVID-19, but I have to say the recent announcements of an effective or a number of effective, potentially effective vaccines have, for me, provided significant light at the end of the tunnel. And reflecting on how the last 9 months or so have impacted on me, on us, I think three things stand out for me. So firstly, people's capacity to be fundamentally caring and compassionate to one another is amazing to see. Secondly, the breaking down of barriers, so the removing of bureaucracy to become more effective, I think has been really clear, particularly within our local health and care system. And of course, the fact that we're better when we work together. We're better when we work in a combined way. And I don't apologise for that pun. So I'm really proud to say that these fundamental principles of compassion, effectiveness and inclusivity are absolutely woven into our strategy that we will present in a moment. So what we will now share with you are 5 short films that in total only come to around 30 minutes that describe the various themes within our new strategy. And as David mentioned, there'll be an opportunity for questions and answers at the end of those films, but you can also add any questions that you may have within the chat facility as we play these videos. So hopefully you will thoroughly enjoy the next 30 minutes, and I look forward to a good quality conversation afterwards. Hello, and welcome to North Staffordshire Combined Healthcare NHS Trust strategy for 2020 and beyond. We're a trust which prides itself on achieving the best possible outcomes for our service users. And this strategy outlines our ambition over the next 4 years to achieve that. Significant progress has been made over recent years, which culminated in the trust being rated as outstanding by the Care Quality Commission. We are one of only a small number of trusts to achieve this standard, and one of only 2 mental health specialist trusts to have done this. We're very proud of this achievement, of course, and have continued to make significant progress towards improving health outcomes and reducing health inequalities for the communities we serve. Our updated strategy sets out our sustained commitment to continuously improve services and takes account of national requirements and, of course, local priorities. The NHS Long-Term Plan, published in January 2019, placed particular emphasis on the expansion and extension of mental health services over a 10-year period. We will therefore have continued focus on quality, people, partnerships and sustainability to ensure that we can achieve those commitments through safe and effective services, which will enable our communities to live their lives fully and well. The NHS Long-Term Plan also has a strong focus on joining up primary, community, mental health and acute services, together with new governance arrangements which will support providers to have greater influence on service improvement and integration. The Trust's established partnerships with other NHS providers, commissioners, local authorities, police and third sector organisations, together with our proven success in collaborative working, puts us in a really strong position to take a leading role in shaping the future design and development of services across Northern Staffordshire. Our staff already deliver excellent care and treatment. They are compassionate and committed to helping service users and their families. Through this strategy, we'll continue to create a culture where they feel encouraged and supported, as well as being empowered to find new and innovative ways to improve care delivery and supporting services. We know that health and care services continue to experience pressure and resources can be scarce. Our organisational strategy will support us in making the best use of resources by focusing on sustainable healthcare to generate financial, environmental and social value. The Trust has recently been confirmed as one of only 24 trusts to be included within the National Digital Aspirant Programme. Alongside our existing progress as part of the Lorenzo Digital Exemplar Programme, we've a clear direction to help us realise the NHS long-term plan vision for digitally enabled care. We, of course, also look forward to working with our staff, board members and our broader partners to deliver this strategy and further improve the care we deliver. Detailed plans and further information on each of the 4 strands of our strategy is available via our Trust website, and we really hope that you find this useful. And we'll be carrying out one of the most extensive engagement exercises combined as ever undertaken with staff, service users, families, and all of our local partners and stakeholders, so that we hear as wide a range of voices, insights and opinions as possible as we look to introduce and embed the fantastic outcomes and innovation which are built into our refresh strategy. So many thanks for taking the time to learn a little about our aims, ambitions as we look beyond 2020. I really look forward to hearing your views and working with you all as our fantastic future unfolds.
I'm very pleased to introduce to you our quality strategy. This is a key organisational strategy which describes the priorities and methodology for how we as an NHS Trust will continue to deliver services which aim to meet the needs of our local population over the coming years.
Following the CQC inspection of the Trust in 2016, we received a good rating and immediately launched our campaign towards outstanding. This set ourselves the aim of providing the highest quality clinical care and ensuring excellence in mental health and learning disability services. We sought to evidence this through our approach to achieving outstanding rating by the CQC, which we achieved in 2019.
We have bold plans for service transformation across a number of our services over the next 5 years. The NHS Long-Term Plan and Mental Health Implementation Plan set out significant investment in mental health services, and over the life of this strategy, we will shape the detail of what this means for us at a local level in North Staffordshire and Stoke-on-Trent.
Our quality strategy aims to support and deliver the local mental health implementation plan, recognise the importance of focusing on quality as the developments proposed within the mental health implementation plan are implemented. We intend to strengthen our culture of strong clinical leadership, and this will be critical to the successful implementation of this strategy. To ensure success, our clinical and management practice and behaviours will be focused on distributed leadership, multidisciplinary team working, continuous improvement, all with the core purpose of providing outstanding care for our service users and their families.
During 2020, more than ever before, the impact of COVID-19 has shone a light on the health inequalities which are experienced locally, nationally, and across the globe. A number of our communities have been disproportionately directly impacted by the virus and will also feel the wider impacts of the virus in relation to the mental health and well-being for years to come. Those with mental health conditions and learning disabilities have significantly poorer health and well-being outcomes than those of the general population, including complex physical health problems and earlier death. To be outstanding in all we do and how we do it, we must all fulfill a role in tackling these inequalities.
We aim to achieve the commitments of this quality strategy through harnessing the potential contained within our workforce, our service users and carers, to further embed quality and performance using our SPAR quality priorities each year of this life strategy to provide the best care they can. So, how are we going to do this?
We aim to be the provider of the highest quality mental health and learning disability services in the NHS. We will be relentless in our pursuit of identifying and reducing harm, including human, process and systemic errors which could cause harm to people. In mental health, this will also include self-harm and suicide.
We'll have clear cycles for reviewing the effectiveness and responsiveness of our service provision with key partners across health and social care, including, most importantly, service users and carers. Our clinical staff will provide interventions and care which is evidence-based and targeted to the population we serve. It will make use of the latest technology and innovation to ensure effectiveness. We'll provide care which is person-centred and responsive to people's needs and reflective of their beliefs, culture and spirituality.
Our approach to achieving consistently high quality has 4 key components. The first one, planning for quality. We will ensure that our clinical services meet the needs of our service users and population. We will ensure clinical practice is based upon the best evidence and innovative practice using our clinicians, service users, and local, regional and national networks.
We'll have a good assurance mechanisms, so we'll undertake periodic reviews using different things such as audit, internal insurance visits, peer reviews, and make sure that good care is being delivered in keeping with the terms of our CQC registration. We will identify and deliver actions to address any identified deficits.
The third, quality control. We will have effective operational management, which will monitor performance and quality metrics in clinical services and intervene when necessary to ensure quality is maintained. This will include the use of safety huddles, team meetings, and reviewing quality as part of day-to-day business as usual.
And lastly, quality improvement will use QI methodology to identify, test and implement changes required to tackle complex issues. This will involve all of our clinical teams, service users, working together with QI experts in close detail with those who understand the issues most.
We will have agreed processes and structures in all services, including community-based services, to ensure that safe staffing is in place to meet the needs of the people in our communities. We will have leadership development opportunities available to all clinical and managerial staff.
We will invest in staff to have pathways to further their knowledge, skills and careers. And we will make full use of technology to deliver outstanding care and support our staff to work effectively. We will ensure the development of the new integrated care partnerships, our places, and primary care networks, which are our communities, are focused on quality as defined in this strategy.
The services which the Trust will provide in partnership will clearly reflect the needs of our communities. This will be empirically based on the evidence of need, and rationale of how we deliver these services will be based on what our people, both staff and service users, tell us. There will be integrated care pathways working across NHS, local government, citizens and voluntary, community and social enterprise organisations, delivering effective seamless care and treatment for our communities. We will work with our health and social care partners in our communities to identify and address health inequalities and have plans to address them.
And we will have multidisciplinary working between clinical and academic partners, including joint clinical academic roles with local universities, and all trust professional groups will be regularly publishing in academic journals. We will utilise various approaches to ensuring our services are sustainable and effective and efficient. We will use benchmarking data to challenge ourselves, identifying variation in our services when comparing ourselves with other organisations.
When identifying this variation, we'll have processes to interrogate, analyse and understand this variance to identify whether it's warranted or unwarranted variation. Where unwarranted variation exists, we will apply quality improvement methodology to drive process improvement, evidence change and spread good practice.
We'll undertake quality improvement assessments through the lens of our quality priorities, that is safe, personalised, accessible and recovery focused, to ensure that all aspects of quality are considered. And where possible, we will seek to improve quality in every organisational change process we make. We will use technology appraisals in redesigning our services to make sure that models of care incorporate innovation and enable us to respond to the needs of our communities.
Many thanks for taking the time to learn a little about our aims and ambitions for our quality strategy as we look beyond 2020.
I really look forward to hearing views and working with you all as our fantastic future unfolds.
Hello everyone, my name is Shajida Ahmed and I'm here to talk to you about the People Strategy for 2020 and beyond. I'm delighted to introduce the key elements of our People Strategy, which we are calling our promise to support our people. The NHS People Plan, which was recently launched, highlights 4 national priority areas deemed as crucial to supporting transformation across the NHS. These priorities focus on how we support each other and foster a culture of inclusion and belonging, as well as growing our workforce and working differently to deliver patient care. Our People Strategy articulates how we will deliver on these national priorities by improving the working experience of our people in the Trust and wider across the health and social care system through our 4 People Promises. Our 4 People Promises are having an inclusive culture. We want to create an inclusive and empowering culture. Health and well-being, supporting the health and well-being of our people, which is absolutely crucial to everything we do. Engagement, listening to what our people have to tell us, and having a sustainable workforce to help you to be excellent in the jobs that you do. Our people are crucial to the delivery of excellent, high quality, safe, person-centred care. The NHS, as we know, has huge national challenges of attracting applicants and filling vacancies, especially with a particular specialist clinical roles and at executive level. We need to deliver high quality care today, but we also need to plan for tomorrow to ensure that we are still able to deliver this high quality care to the people in our local communities and their changing demographics. The changing landscape of health and social care and the development of integrated care systems will require all our people to work in different ways, working more collaboratively and develop more effective partnership with other partners in our system. We have taken a broad approach to inclusion at the Trust, recognising equality groups both within the protected characteristics groups listed in the Equality Act 2020, but also recognise other groups outside of this protected set. We additionally recognise intersectionality, for example, people that do not sit in discrete boxes but have a number of different identities in one. For example, older gay trans women, young black straight men, etc. Notwithstanding this, key areas of focus for us are in developing greater equality and inclusion in relation to race, sexuality, gender, and gender identity and disability. Our People Strategy has been developed through various engagement activities with our people as we work towards creating an integrated care system. So, what are some of the key elements of our People Strategy? First is quality. We want to be seen as an employer of social inclusion, especially for people with protected characteristics. We want proportionate representation of our workforce, reflecting our local demographics and population. We want a climate of inclusion where people feel able and supported to disclose their background, and where the Trust works hard to achieve a culture of support and inclusion. And we want a just and restorative culture where these principles are embedded throughout the organisation. We want to increase the supply of quality development opportunities online and to expand our use of digital opportunities across all professions and services. We want to improve progression opportunities. Our talent strategy will be successfully embedded in the organisation, so our approach becomes ingrained in our culture and our ways of working. Talent metrics will help improve the quality of succession and workforce planning, and we will enable managers to have high quality talent conversations with their staff. For our people, the most important thing is to look after them with a comprehensive health and well-being offer which is sustained on a long-term basis. The health and well-being of our people is pivotal in terms of delivering on our people strategy, but equally our leaders are pivotal in creating this environment and culture within our teams. Our people don't exist in isolation, and neither does our Trust. We will therefore continue to be a strong partner and play a leading role in the development of our local health and care system. In particular, we will improve inclusion and our widening participation approach across both our Trust and the wider system, ensuring that we engage and develop in ways that support the needs of our diverse local communities and our diverse workforce. So a huge thanks for taking the time to learn a little bit about our aims and ambitions for our people strategy as we move beyond 2020. I do really look forward to hearing your views and working with you as our fantastic future unfolds.
Purposely within our partnership strategy, we're setting our sights beyond our immediate organisational boundaries. We want to actively consider the role we can play in promoting wider community resilience by working collaboratively with partners to reduce health inequalities and enhance health and care services. Big focus for us this year will be integrated care partnerships. So that's groups of providers, whether that's NHS organisations such as ourselves, UHM and MPFT, general practice, local authorities and voluntary sector providers working together to consider how best we can integrate services across the health and care economy. By focusing on the population of North Staffordshire, we can collectively bring care closer to home and improve outcomes for our citizens, patients and service users. Within our partnership strategy, we also want to be very clear that as an organisation, we think we can achieve more by working collaboratively with partners than we would do by simply working in isolation. In particular, we want to strengthen our relationships with primary care, specifically general practice, and the voluntary sector. So a key aspect of this will be the integration of the partnering strategy with our approach to stakeholder engagement, and a particular focus on active listening. So that means we don't simply listen for the sake of it. We will understand what we're being told, we will respond to it, and we'll be seen to do so. I also want to talk about sustainability, and specifically environmental sustainability. This has become an increasing area of focus for the NHS nationally. Included in the NHS long-term plan published in 2019 were a small number of big targets around sustainability, reducing carbon, improving air quality, and the eradication of single-use plastics. In fact, our Trust Board in January 2020 signed an NHS pledge that would reduce our use of single-use plastics over the next couple of years. More recently, the NHS has now published a net carbon zero commitment and has appointed its first Chief Sustainability Officer. As we move forward, we will be publishing an SDMP, Sustainability Development Management Plan, and that will be a focal point for all our activities to drive forwards our sustainability efforts. We will also be launching a sustainability group that will have exec level chairmanship through myself and will act to coordinate the delivery of the Sustainable Delivery Management Plan. To help us frame all this work, we will be adopting an anchor institution approach, and that's a phrase that you may hear more and more over the coming years. In essence, it's a phrase which reflects the fact that we are a provider of mental health services. That is our core purpose and will continue to be so. But in so doing, we recruit staff from our local community. We consume goods and services from our local businesses, and our local schools, colleges and universities provide the skills for our workforce of the future. By working together in this way, we can both improve our services, but also enhance the social and economic prosperity of our local community. What a few months it's been for the digital team. I think it's fair to say, along with a number of our services, that this year hasn't quite panned out as we anticipated. and we had to very, very quickly recalibrate our plans as we went into the spring. I will talk about the strategy, but I also just want to take a brief moment to congratulate the digital team on the monumental effort they've made over the past few weeks and months to improve the reliability and resilience of our connections, to roll out our collaborative meeting space, and to roll out our video consultation software. It's been fantastic, and it's really testament to the hard work that they've put in. Looking forward, we want to build on our successes. So already within national digital circles, we have a really strong reputation. We were one of only 4 trusts to be included in the Lorenzo Digital Exemplar programme, and in fact the only mental health trust. And more recently, we were really fortunate to be included as one of only 24 trusts nationally as part of the new National Digital Aspirants programme. And that's provided a huge opportunity for us to really deliver digital transformation at scale over the next few years. So what will that look like? We'll be bringing forward a programme of clinical readiness. This will help our clinicians have access to the right information in the right place and at the right time, whether that's at home as part of our new arrangements for agile working, or whether it's across all our estate and in the community. And that doesn't sound much, but when you consider that a large part of Northern Staffordshire is rural by nature and we have huge variation in digital connectivity, it's a really big undertaking and one that will make a huge difference to our clinical teams. We want to continue to roll out the transition of some of our services onto digital platforms. Building on the success of the CAMHS Digital Exemplar, we want to extend that to other services so that service users, our clinicians and other professionals involved in their care can be more empowered to take direct control over their own care needs and arrangements. We'll also be bringing forward some targeted transformation to enhance care pathways and make sure that Lorenzo, our electronic patient record, keeps pace with end user expectations and changing clinical practice. Working together with system partners, we'll also be upgrading our technological infrastructure. This will ensure that we've got a reliable and resilient connection to all our systems, whether they're clinical or corporate, in whichever setting you choose to use them, at home, across our estate, or out in the community. And I'm pleased to say that over the next 12 months, we'll be upgrading all our connection infrastructure, starting with the Hartlands Hospital.
Okay, I hope you enjoyed that. What we want to do now is to deal with questions, and we've had a number of questions in already, which we'll work our way through. But if there are questions that have occurred to you during this presentation, then there's a chat function, and by all means, pop them onto there, and we'll do our best to work our way through them. So if we can see the questions that are, yes, I think we can. There we go. One from Healthwatch, just to get us going. I'm not going to read them out, it's a bit tedious, but the first question is about how we tackle digital poverty, which, you know, in terms of inequality, is a real problem that we have to overcome if we're going to serve our communities in a comprehensive way. Can I go over to Chris to answer that question?
Thank you, Chair, and thank you for the question. So it's a really good one, and one that's really important to us, and one that we're actively considering in a range of different forums with colleagues across other public bodies and the voluntary sector at the moment, actually. Mindful that the question is about the future, just a quick word on the present. We are, the majority of our community services are currently delivered by telephone or digital means. And when I say digital, I mean a PC, a laptop, some kind of handheld device, tablet or smartphone, etc. And that's been a big shift for us over the past few months as part of the response to the COVID pandemic, as I'm sure people can appreciate. And we've had to deploy some new software at pace to enable that change to happen. and that's supported by proactive management of clinical risk, both here and now, and that will be a feature that continues going forward. So with that in mind and looking forward, our strategy does include an ambition to increase our digital service, and this will complement rather than replace face-to-face services. So we are moving towards a blended model, not an exclusive model. Where we do develop digital services, we will work with our service users to inform that offer, as indeed we did with the CAMHS digital exemplar that went live at Easter, and that was co-designed, co-produced with the young people. It was very much designed to support at the point that it went live. That said, we do recognise digital service delivery is not for everyone, and nor does it fit with every service that we provide. So as I say, much more of a blended model rather than an exclusive model. In terms of challenges, we recognise there are some challenges around digital poverty. When we talk about digital poverty, what we mean is lack of access to kit, lack of access to the PC, to the laptop, to that handheld device that I mentioned earlier. And we are aware that some organisations are already providing access to kit, either providing it or loaning it to certain service user cohorts. We think it's a bit more complex than that, and the provision of kit in and of itself we don't think necessarily answers the full challenge, because we're also aware of issues around variability of internet connectivity, the availability of public Wi-Fi, and availability of appropriate, what often can be difficult and confidential conversations. So what we're going to bring forward, working in partnership with other organisations, is a much more rounded set of solutions and proposals. And that work starts tomorrow. In fact, coincidentally, we've got a conversation with colleagues in the Northern Staffordshire GP Federation and other public agencies about how collectively we can harmonise our response to some of the challenges that we've seen, and therefore maximise the impact that it has. I hope that provides a full and frank answer to the question.
Okay, thank you very much, Chris. Can we move on to the next question? This is also from Healthwatch, and it's about access to mental health care, particularly given that it's absolutely inevitable that COVID has already increased the volume of referrals to the service, both directly by people who have suffered from COVID and indirectly from people who have suffered from the anxiety that COVID has engendered and the insecurity and so on. So, Peter, could I go over to you to answer that?
Yes, no problem, David. So what I would say on this is an important point around what this strategy means. So for us as an organisation, this is effectively the springboard to then move forward into 21-22 with what we would call a clinical transformation plan. And that clinical transformation plan will, of course, be created using the principles, the themes that we've described today across our 4 key strategic themes. But essentially what that transformation plan will do is address the fundamental issues that we have at the moment across the system in relation to access to care, arrangements that may not be, are effectively imperfect across the system from a mental health and learning disabilities perspective. That transformation agenda is helpfully supported by the National Mental Health Long-Term Plan, which I've alluded to on a few occasions now in this type of forum, including I think the annual general meeting that we held not long ago. That long-term plan is supported by funding on an annual basis. So we've got a massive opportunity as an organisation to use the principles and the themes that we've developed through this strategy to evolve a clinical transformation plan for implementation next year and beyond that fundamentally addresses inequalities. It fundamentally addresses the challenges that COVID has posed. And we're under no illusion that COVID won't impact heavily on mental health. And the key challenge, of course, for mental health in COVID terms is that it's here for the long haul. It's here for an extended period of time. Some projections are suggesting that over the next 3 or 4 years, it will take that kind of period for us to fundamentally understand the significance of the impact that COVID has on mental health. So we've got a short period of time, and it is only short, to ensure that that clinical transformation programme fundamentally addresses those projections and predictions in relation to the mental health impact of COVID.
Okay, thanks very much, Peter. Can we move on to the next one? This is from our good old friend Ian Syme, well, not so old. The statistics on COVID deaths within the LD community are shocking, and what's Combine doing to combat this and help the LD community on the dangers of COVID-19? Is that one for you, Kenny, do you think? Could you give us some guidance on that?
Absolutely. Thank you, Chair. So, yeah, absolutely key issue for health and equality associated with COVID-19, and we reference that heavily within the quality strategy, our ambition to tackle health equality that we see across various different populations and communities in Stoke-on-Trent and North Staffordshire. So thanks for asking the question. So the LD service has really gone above and beyond during COVID-19 would be my position. There's a few things I'd like to kind of highlight in terms of the practice from a clinical perspective. So as soon as COVID-19 happened back in the spring, all the learning disability teams commenced a review of their caseloads to identify a high vulnerable list from people with learning disabilities who they felt were a greater risk from COVID-19. That was either because of physical health conditions or actually because of their conditions. They'd find the restrictions imposed through lockdown particularly challenging. And that's been particularly true for people with autism who use our service. They've been really proactive in providing information to clients with LD, including easy read documentation about COVID-19, how to self-isolate, what a lockdown means, involving families and carers, placements and other partners in terms of helping people with learning disability to understand the implications and how to cope with those. They've been really flexible in supporting people when they've been self-isolating with COVID-19. So in reaching into people's places of residence and homes to offer that support during what can be a really difficult period of time for people with learning disability and autism. And they've even provided support around desensitisation when people with learning disability and autism have had to have COVID tests. And for anyone that's had a PCR COVID test, it's not the most pleasant experience having to have a swab. So for people with sensory needs, it's been really, really challenging. And again, the teams have worked really hard to support that activity and keep people safe. We've been procuring special face masks, which are transparent. So actually people who use Makaton or who have got hearing impairments or communication issues with learning disability have been able to understand our staff in a better way due to those adaptations. And we've also reviewed, as a learning disability service, the early report, which was produced by Leader around COVID-19 mortality, which had quite a lot of clinical and practice recommendations within it, to make sure that both our teams, the people that use our services, and also our partners, which we're really reliant on in terms of care providers that are not within the NHS or statutory sector, also have had that learning. So we've shared it across the system to make sure people with learning disabilities have also been well catered for. So there are a few things that I would highlight, but I think in summary, the learning disability teams have been really, really sensitive to the increased risk and really gone above and beyond to try and keep people safe.
Okay, thanks, Kenny. I think we can move on to the next one, which is Ian again. How Combined with partners can aid in ensuring the fault lines in care provision that COVID pandemic has exposed are not only acknowledged, but actions are taken to truly address these inequities. So that's, there have always been fault lines in care provision. The COVID pandemic has enabled us to be much more flexible and to change the way in which we deliver services. So as soon as we can identify fault lines, we're much more agile and able to move to cover them. But is there anything, Peter, you'd like to add to that one?
Yes, I mean, how long have we got, frankly? This is a hugely important subject. I suppose for me, the two key elements of our new strategy that absolutely go to this point are orientated around, firstly, partnerships. So the emerging relationship that we have across the system, the north area of Staffordshire in terms of the Northern ICP Integrated Care Partnership, for me, is the fundamental tool, the fundamental mechanism to address the challenges that Ian's posed within the question. The objective of integrated care partnerships, that place-based delivery agenda, is to ensure that people work better together. That synergistic objective of understanding that we're better than the sum of the parts of us individually. And so for me, I know that the energy that I'm putting in, the energy that the senior team and combined, and I'm absolutely convinced the energy across health and social care partners, the voluntary sector, etc., in that integrated care programme, not just in the north of Staffordshire, but also for the southeast and the southwest partnerships across Staffordshire, is absolutely at the top of everybody's agenda. So we're going to work tirelessly over the next 6 months or so to ensure that those integrated care partnerships make a difference. I think people occasionally in the NHS get, if you like, change fatigue. They see a new initiative, a new agenda, a new idea, and they kind of just notch it off straight away to the next in a long line. For me, we have to dispel the myth that change in the NHS comes around regularly and doesn't do anything with the integrated care partnership piece. It's massively important to us. I'm convinced it will make a huge amount of difference for the population of North Staffordshire. And if you add that to one or two of the other key themes within this strategy, so digital, for example, and sustainability, for me, we've got a fantastic collection of key principles that will enable it to happen. So if you take, just for a second, digital, the piece around population health management, and I wrote the term down that Chris mentioned in the video a moment ago, the clinical readiness piece, ensuring that we've got information and data down to street level, down to house level, for me is the only way that we can tackle inequalities and the challenges that COVID has clearly posed to us. We have to be agile with data. We have to convert data into information, into intelligence, and into clinical design and redesign. And only by doing that, only through that process, will we be able to understand where inequalities lie, where the fault lines lie, where people are falling between the cracks, and fundamentally address that. I'm so excited, as you can probably tell, about the whole piece around integrated care partnerships, but coupling that with the digital agenda and an enthusiasm to progress in that direction, and fundamental trust, the creation of fundamental trust across agencies, which is critical to all of this. With all of those things together, I think we've got a huge opportunity to improve the provision of health and social care in North Staffordshire over coming weeks, months and years.
That's brilliant. Thank you very much, Peter. Have we got some more questions? Yes. What sort of QI method? Sorry, it moved. Well, there are two things going on here. One is, and they're both in the same neck of the woods in a sense. What do we mean by talent conversation? and how we going about this business of QI. I can probably land both of those with you, Shajida, couldn't I?
Thank you, David. I have responded in the chat. So when we talk about talent conversation, I have said that there's a lot of work that's going on nationally, regionally, and across our system. And it is one of the core aspects of the National People Plan. And that's simply because talent management is very much around supporting, developing our staff, but also retaining our staff, because we want to do everything we can to keep staff within their roles and help develop them. In terms of our PDR process, all of that will shape and influence our PDR process to encourage those career conversations between the manager and our staff members. So we will be looking at reviewing that as well. So lots of work going on across the system. It is one of our deliverables. And as I've said, it's something that we will look at as part of our strategy as we move forward within 2021 and beyond. So lots going on at the moment, but I hope that gives you a flavour of some of the steps that we're taking.
Okay, thanks ever so much. I think we're coming towards the end. I know there's a comment in the chat too from Sarah about the vital role that the psychiatric liaison services perform at the hospital at this time, because it is such a crucial part of what we do, and such a difficult and testing part. Kenny, did you want to say something about that?
Yes, more than happy to. So QI is a key part of what we want to do in terms of our quality strategy. It's strong within the quality strategy, and it's a key enabler for our improvement. So in terms of our methodology, several of our staff have been trained in QI methodologies, and that has been around the IHI model for quality improvement. We aim within the quality strategy, it sets out our ambition to have more staff trained at a larger scale, and that'll drive in turn more quality improvement activity. Of course, with COVID, it's very difficult, and nationally QI has kind of been stood down as part of the response to COVID. But as soon as we get through this period of time, and as Peter said at the start, it looks more and more optimistic with the vaccination on the way, our QI activity will pick up again, and we've got a real clear trajectory about how we want to improve that and increase the activity.
Okay, that's brilliant. I think we're coming to the end of our questions. Can I just say two things very quickly? I want to hand over to Peter to talk about what's next. But just to say, we've got over 60 people on this, which is really rewarding for us, and we really appreciate that level of support. So thank you very much. Peter, do you want to have a talk about what comes next?
Thank you, David, and I'll second the thanks to everybody on the call. I'm delighted that we've got so many people. As I mentioned at the start, most I know, but a number I don't. So a huge thank you. So you can see the slide that's in front of you describes how we will go about the next steps. I mentioned a moment ago the clinical transformation plan that is evolving. So essentially what we are doing is taking the platform that are the four strategic themes, as you've seen today, and using them to drive forward to build our clinical transformation plan. So as information emerges over coming weeks and months with regards to such things as the financial outlook for next year and other planning documentation, I think we'll be in a fantastic position to be able to evolve the nuances within that transformation plan. So our objective is from here to ensure that we communicate with as many of you as possible, both of course our staff within Combine, but also those across the system in the various stakeholder organisations that we have, to fundamentally understand what's important to you within our strategy, but to also of course, have a dialogue with you about what we feel is important in that regard as well. So have a two-way communication to nuance the implementation of our strategy. What we've presented today is a starter for 10. We feel that it's a good quality starter for 10 that addresses some of the key challenges and opportunities that we've got as an organisation, but it's not the finished article. We've got a real opportunity over coming weeks and months to ensure that the dialogue that we have with you delivers a really high quality clinical transformation plan by the end of March 2021. So please do get involved, and there'll be a variety of ways of doing that. You can see the slide in front of you, but Joe McRae, the team, the communications team at Combined, have a hugely innovative set of methods, of ways of ensuring that you can communicate with us and be involved in the conversation. So my final word, I suppose, is a plea. Please do ensure that you come with us on the next 3, 4, 5 month journey that we have to land the best quality transformation programme that Combined Healthcare has ever seen.
Thank you, Peter. I'm just about to sign off. Before I do, I just wanted to pass on to you a message really that John Henderson, who's Chief Executive of Staffordshire County Council, mentioned at a meeting earlier today, which I thought is worth repeating. He said, look, this is, I'm afraid, going to take a long time to get through the difficulties, the horrors, the stresses of COVID. It's a long haul, but it will be a haul that is not absolutely continuous, and there will be flat spots on it where there is the opportunity, whether you work for us or whether you work elsewhere or whether you're caring for people, there will be opportunities to have a short break. And for goodness sake, take every single opportunity, because it is just so stressful. You cannot go on continuously without that sort of break. So look out for them and take them whenever you can. And take care, and thank you very much for joining us today. Thank you so much. Okay, goodbye.
Bye-bye. Thank you.